Welcome. Hi, I'm Mikki, and this is Mikkipedia, where I sit down and chat to doctors, professors, athletes, practitioners, and experts in their fields related to health, nutrition, fitness, and well-being. And I'm delighted that you're here. Hey team, Mikki here. You're listening to Mikkipedia, and this week on the podcast, I speak to Dr. Kwadwo Kyeremanteng about health in the time of COVID. So Dr. Kwadwo is an ICU and intensive care unit doctor in Ottawa, Canada. And he's also got his Masters of Health Administration. He's a podcast host, Solving Healthcare, and he runs a Resource Optimization Network, which is a research institute with the goal of transforming healthcare and optimizing the use of healthcare resources. Dr. Kwadwo was frontline as the first cases hit Ottawa of COVID, and he shares his experiences and perspectives. And he was also a go-to for mainstream media. He talks about what he saw day to day versus what was being highlighted in the media, and his realization that underlying poor metabolic health was a big driver for the severity of the illness. Yet this was not a message that was readily put out there by mainstream media. So we discussed that. And while the dust has almost settled on COVID, the PTSD associated with it totally remains. And we chat about how important that metabolic health piece is, not only to protect you in the here and now, but ultimately in the long run for optimal health. And Dr. Kwadwo is so passionate about this, and you get that from his Substack, from his podcast, and just from how he talks about this topic. And I just think his experiences of it is a really great take on some of the challenges that existed for not only him working on the front line, but actually him as a messenger in and around that COVID times. So we talk all about this and more on the podcast. And I don't know how many of you will be familiar with Dr. Kwadwo actually, because I came across him at Low Carb Denver, where I was a participant and also was an MC, and I was his MC actually on that Sunday. So Dr. Kwadwo Kyeremanteng is a critical care and palliative care physician at the Ottawa Hospital. Dr. Kwadwo cares for the sickest of the sick patients in the intensive care unit, and as a researcher, he is interested in using ICU resources more efficiently and improving access to palliative care in the ICU. To help do this, he founded the Resource Optimization Network, a multidisciplinary research group working to reduce health spending in this area without compromising care. In September 2019, Dr. Kwadwo launched his ever-growing podcast, Solving Healthcare. And these podcasts feature interviews and discussions on the topic of improving healthcare delivery in Canada, but also about healthcare at the individual level and metabolic health and what you can do to help yourself. Underpinned by the values of cost-effectiveness, dignity, and justice, these podcasts will challenge the status quo, leaving no stone unturned as he explores gaps, assumptions, and different perspectives in the pursuit of finding solutions to problems in Canada's healthcare system. So Dr. Kwadwo Kyeremanteng can be found at thekwadcast.substack.com, and there are links in the show notes to that. And just before we kick off into the interview, which I think you're going to love, just a reminder that the best way to support this podcast is to hit the subscribe button on your favourite podcast listening platform. That increases the visibility of the podcast in amongst the thousands of podcasts that are out there that people could choose to listen to. All right, team, please enjoy this conversation that I have with Dr. Kwadwo Kyeremanteng. Yeah, it's funny actually. I'm an early morning person, and there's a real sort of like virtue signaling around being like an early bird, you know, like, hey, am I the better person because I get up at 5?
Exactly, like all that productivity stuff about all these gurus waking up mad early.
I know, except of course, the people like me that get up mad early are also mad tired at about 4 o'clock and do bugger all, basically.
100%. I think naturally I'm a bit of a night owl, but the kids have ruined that.
Or improved that for you.
I like that reframe.
Yeah. It's always about the reframe, Kwadwo. Yeah. So, Hey, thanks so much, Tara, for taking the time to speak to me today. So your talk at Low Carb Denver really resonated with me. And I think it was, I've always seen Canada and New Zealand, we're like, cuzzy bros. We love Australia because Australia is like our annoying older brother, but you guys have always sort of like, you're just there. And there were a lot of parallels I felt between New Zealand and Canada throughout the pandemic. And even though the pandemic is, people could argue it's done and dusted and we should all move on, I feel like there's a lot of PTSD still actually that is present and almost unrecognized, which isn't really the topic of what we will potentially talk about today, but I just think it's worth acknowledging. And so I think that's one of the reasons why I was sitting there in February, listening to you talk, and it really just, that's the thing that I sort of thought about, Kwadwo. So thank you for taking time to share that with my listeners.
Well, what you're describing is we felt it. Like I still see the PTSD. Like people, like I completely agree.
Yeah. And it's, I speak to clients actually, and of course we're going to get into your background in a minute, but just because we're on it, like I talk to clients about their nutrition and every day, and there's just this element of stress that has yet to subside, and it's this undercurrent. I mean, life is stressful anyway. There are so many things going on, but then layering on top of it, they talk about these habits that they developed in lockdown, yet lockdown was, over 18 months ago now, yet they have yet to sort of get back to a sense of balance within an already sort of unbalanced life. And I don't know if that's what you've also experienced.
100%. The mental health side, like the people are just, it's like, I feel like the underlying tone, they're hyper vigilant. Their ability to also get back to where that we've been, like socially and all these things has been restricted, or it's been impaired, I should say. I definitely concur. Like, I definitely agree with what you're saying. Yeah, I see it on a regular basis. Even personally, I'll be honest with you, I'm not as social of a butterfly as I normally was. And I think this is because I haven't had to exercise the muscle to the same degree.
Yeah. Oh, and isn't that it, right? If you was it use it or lose it?
Yeah.
Kwadwo, can we take a step back and start with a little bit of your background? So sort of professionally, what is it that you do? What is your sort of day-to-day?
All right, Mikki, I'm Kwadwo Kyeremanteng. I'm an ICU Doc. I'm also department head of critical care at my hospital. I have my other jobs in palliative care. And when I'm not working in the ICU, I do podcasting, I do research. And so busy, and the day-to-day of the intensive care life is wild. Like I start tomorrow in the ICU, start off bright and early. We'll do some teaching to the trainees, start seeing our patients, and the challenge of the intensive care unit is you're not sure what to expect. Sometimes the patients are super stable. All of a sudden you'll get somebody that's really sick, bleeding, that needs intervention sooner than later. So that's part of the challenges of working in the intensive care unit. You're not sure what's going to walk through the door, but also that's part of the why a lot of us are drawn to it.
Yeah.
And every day is a bit different. And so you spend your day managing the sick patients. Communication is a big piece of our job, but it's a heavy job, but I would not want to do anything else, Mikki. I love it.
So interesting, Kwadwo, because you've got that aspect of the acute sort of life or death situation, yet a lot of the content that you put out there in your podcast and your Substack is about health and wellness and nutrition and exercise and lifestyle and metabolic health. So, of course, in your talk, you talked about how you were frontline in COVID with the first COVID patient really that came through Ottawa. That's right, hey?
Through our hospital was one of the first,
Yeah. Can I ask, Kwadwo, like this other element of your interest around metabolic health and nutrition and wellness, was that sitting in the background as the pandemic sort of kicked off, or was this something that developed after? Like, what is that timeline like?
Yeah, Mikki, great question. It was actually, if I'm being honest, it was during the pandemic. I always had an affinity for like healthy living. We were always trying to be example for our kids, but it wasn't something that was of peak interest for me. And then the pandemic hit, and then you realized how metabolic syndrome was a massive driver. Like, I don't know if people still don't understand or not, but I have yet to still, in my 3 years of taking care of COVID patients, I still haven't taken care of somebody that was completely healthy. And I'll give that caveat. I'm sure it's happened elsewhere, but even the young patients we saw were extremely obese, as an example, and not, they were deemed healthy because they weren't on medication, but these were unhealthy folks. And my area of research has been typically on how we can be more effective with our resources, and it all clicked together to me that if we emphasize prevention, then people aren't coming into the intensive care unit and suffering from their PTSD, their anxiety, depression, their deconditioning, how it affects the family. Because often, if you land in ICU really sick, you're not coming out the same, and your family's going to have to mobilize resources. But like, it was a big aha moment for me to say, like, why don't we focus on prevention? But then the crazy thing for me, Mikki, was as a guy that trained in, first it's internal medicine, so you learn nuances of organ function and such. I did not know you could reverse type 2 diabetes. I did not know. That's not something we learned about in medical school. So then you're telling me there's ways that people can improve, like reverse their metabolic syndrome, reverse their type 2 diabetes. I was like, okay, why are we not preaching this?
Yeah.
Do you know what I mean?
Yeah.
So
100% know
yeah.
what you mean. It's crazy, right? And there are so many like misconceptions out there. Like I was actually doing a talk. It's a little bit of a tangent. Doing a talk a couple of nights ago with a group of people for my sort of fat loss program, and I was just talking about protein and how there are meta-analyses to show that even people at the very people at the very end stage kidney disease, they're people that we need to think about with protein. But protein is entirely healthy for everyone else, and there are doctors on the call and they're like, hang on, my colleagues would really sort of challenge that. And I'm like, I'm like, the information is there, but it's just not consumed by people I feel need to consume it, much like the fact that type 2 diabetes can be reversed.
100%. This is where I don't know, this sounds dramatic, but my mind is completely, like, I'm questioning everything now.
Yeah.
Because
yeah.
the way we educate, the fact that it's so hard for colleagues like myself to comprehend or to have that information available, despite there being several studies to illustrate the benefits of, or whether it's low carb, high protein, keto, and reversing metabolic syndrome. Like, we're so slow to adapt, and maybe we don't seek the information. I'm not sure where the barriers are, but to me, it was almost concerning that, if I'm someone I feel is relatively in the know or relatively attuned to what's the latest and greatest in my field, and I was clueless. It took reading Jason Fung's book, or somebody gave me Jason Fung's book. It took listening to more podcasts, and then hearing the likes of Rob Wolf, the likes of Brett Scher, and saying these things. I was just baffled, and I almost didn't believe it. I had to do my own digging to say, like, are these guys really know what they're talking about?
So, Kwadwo, when was that for you? Because, well, first of all, actually, can you, if it's all right, can you describe the experience of what it was like to be frontline in COVID at that time where no one really knew what was going, like no one, all we heard, like, do you know, I actually remember, Peter Attia.
Yeah.
Yeah, so I was a long-term follower of his, and I remember we were at home here in New Zealand, and it was like February, and I remember him started coming online and talking more. Like I'd seen a little bit in the paper, it wasn't a big deal, but then he gave this massive like live about he had been up all night for like the last 7 days because of this thing coming out of Wuhan, and I'm like, oh my God, I think this is something that we need to be concerned about. But then of course you're in ICU. You come across the first sort of COVID patient for your hospital. Like, was there a lot of fear for you in at that point? Like, what was it like in that situation?
Yeah, Mikki, it was scary. If we all were trying to put on our courageous faces on, and me included, but we all saw what was happening in New York, Italy. At the time,
Yeah.
even Seattle seemed to be going through something, and you were concerned about just being overwhelmed. You were concerned about your own safety. You were concerned about bringing COVID home to your family. Like at the time, I had an immunocompromised caregiver. We had my mother-in-law, who was, at the time in her late 60s, and you worried that there's going to be risk here. And so we were all walking on eggshells. Like when I can't describe that feeling when that first patient came in, because we were all, well, quiet is the word. And I personally, those that know me well, I'm not a quiet person. But when I get anxious or when I get nervous, I just quiet down, and I felt that was the general tone. But then we realized soon after that we were able to protect ourselves. In Ottawa, where I'm from, we were getting overwhelmed in that first wave. And then we saw, like anything, you try and find some trends, like what are the common threads amongst the patients, and it became abundantly clear that there was a link with either being extreme age, immunocompromised, or uh, metabolic syndrome, obesity, type 2 diabetes.
Was that, and in terms of the general information that the public was getting at the time, was that congruent with what people were hearing, or was it this climate of fear? And I think I asked that because in New Zealand that was not the message. The message was we're all at risk, and we all, and it is this, and it was a real climate of fear. What was it like for you guys in Canada?
Same thing. That was part of the reason I became more vocal when it came to the pandemic. My wife's a psychologist, and I remember sitting down for dinner or post dinner, maybe even when the kids were down already, and we were talking about all this fear messaging. Like we would have this conversation. Like I told her, like our kids, I'm not worried about our kids. I'm not worried about us. From what I'm seeing, like it's unhealthy. Folks are getting sick from this. And like the literature was there, but that wasn't the common thread coming through the media at all, right? Like we all need to be fearful. And then we sat down and we said, like, we need to be that a balanced voice. We need to be able to come out and say what we're actually seeing and why we need to have a holistic approach to this thing, because there's going to be some consequences to our lockdowns, our restrictions, the way we're approaching this. And we knew there was a risk of putting ourselves out there. And like for those that, I should have prefaced this, those that are listening that are not from our area, I did a lot of mainstream media locally and nationally to give COVID updates as as an ICU doc. And I would often preach saying like, this is what we're seeing, and try and create a little bit of balance and less fear. Like we control what we can control, right? And um sometimes most of the times it was well received, but the conversation though about metabolic health, nobody wanted to bite on that.
Yeah, interesting. And were your colleagues in the same boat, Kwadwo, in terms of, you had this sort of realization of, these are people who aren't healthy. Maybe what we need to do is sort of focus more on that sort of health, even though obviously ICU is not an area of prevention. But could you have these conversations with your colleagues, or was there a little bit of a disconnect for in some way?
Yeah, no, good question, Mikki. It was a mix. Like most of the ICU docs at some point realized that this wasn't a disease of healthy folks. Like they we came to the same conclusions at differing timing. The perception of obesity being a risk factor, I think, some were a bit slower to acknowledge that. And the nature, though, of most of my colleagues was we realized that there was less to be anxious about as time went on because we were in it every day. We had the exposure because, I mean, think about it in that. I don't know about for you, Mikki, in that first year or say 6 months, did you know many people that had COVID at that time? You know,
No,
yeah,
we had yeah, not at all. Like we were very I think we got into. I remember someone being blown away that New Zealand got locked down because there was one case of I can't remember which wave it was. I get confused about the waves, but yeah, no, very few people. And if you did have it, there was something seriously wrong with you. It was
yeah,
almost that sort of mentality.
yeah. No, there was a lot of COVID zero talk in New Zealand. Now that I think back, but yeah, so we had the perspective of seeing it and being more familiarized with it, so it was less of a phenomenon, less scary. And so a lot of my colleagues had that perspective with time. But the talk about prevention, it was a safe conversation to have. Most of them saw what acknowledge eventually about the risk factors. But I mean, even I think of one colleague, he lost 30 pounds as a result of what he was seeing in that first wave. He was like, I'm not gonna be a stat. He
Yeah,
through
wow.
fasting and low carb, lost 30 pounds in a relatively short period of time, and knew that he significantly reduced his risk.
Yeah. Do you know here in New Zealand, Kwadwo, there was never a talk about if I think about we had daily update. I'm sure everyone was the same. Daily updates with COVID numbers and stuff, and the all of the messaging was around washing your hands and 6 feet away, or I can't remember something else. There were these sort of three things that this would keep you safe, and there was never check your vitamin D. There was never get out for a walk and there was never think about your health at all, actually. And in fact, it almost became taboo to talk about health as if it was blaming people for getting COVID and it was on them and it was their personal responsibility. It was just this very strange environment where, as a nutritionist, if you said anything about, hey, here are some things you can do to help prevent the possibility of you getting really sick, it was seen as irresponsible, and it was seen as white privilege and all of these things. It was very strange.
This drove me nuts.
Yeah.
I've never seen anything like it. It was like we lost our minds. We did lose our minds. You're telling me because you weren't staying exactly on message, you're dangerous? That was the gist of it all. Like, you're not talking about either getting if your first few messages weren't, stay home, 6 feet away, mask, get vaccinated. Like, if you didn't mention those things out of the gate, you were controversial. And this is such a disservice to the population. Like, think about the opportunity. Like, people were so fearful and they wanted to be empowered, and you provide them with the knowledge or the skills to get healthier, and also put an emphasis on not only you reducing your COVID risk, but you're reducing your risk of cardiovascular disease, stroke, cancer, all these things. You're going to improve your risk for dementia. Like, why won't we just talk about that? Why don't we talk about getting healthy? And it's not mutually exclusive. You're not gonna you're not gonna overcomplicate the situation by people saying, "Hey, this is also something that you need to take care of." But I don't know. I really felt like this was a missed opportunity, and hopefully in the future we learn from it.
Yeah, I'm not as optimistic about that, actually, if I'm honest. I just think about, public health just the way that it is. We've known for years about the risks sort of associated with obesity and carrying excess body fat, but also there is that sort of alongside that is this fat shaming idea. And if you're talking about obesity, then you're making people feel bad about themselves. And I don't know, if I think about the population, Kwadwo, nothing has changed in terms of those health stats. Like everyone just, I don't know how you're going to how people turn the tide on this stuff, because it certainly, I don't think things have changed or been better over the last, 20 years compared to, say, 20 years earlier. I don't know.
It's true. Like it is an uphill battle. I guess when I was saying I hope we learn from this, it's more that next time something like this comes around, that we're not going to be so we're not going to just restrict the messaging. We're not going to just be so antagonistic. But you're right. I mean, if you look at the BMIs of most people now, you look at the rates of obesity, it's all gone up, courtesy of the pandemic. So you're right. We're not talking about it. This fat shaming culture. I mean, I might get in trouble for this, but I think I'm just more of being honest with people. If I know you're at risk because of your weight, I will tell you. Like if you like, I see it on a daily basis, the risk of obesity and what it leads to. Even if you come in for this simple problem, your risk of complications, infections, uh, blood clots, everything gets more complicated. Just death. Like I mean, I think about some of our patients. We had trouble ventilating them, like getting enough oxygen or clearing their carbon dioxide because of their obesity. You know what I mean? Like this is the reality. So if I'm not gonna sugarcoat it if you're putting yourself at risk, but not but it's one thing to just say, you know, don't eat donuts. The other thing too, that why I could, both of us could hold our heads up high, is that we want to provide you with the tools on how you can get healthy and create healthy habits and staying positive and being in love with the process as opposed to, you know, being more focused on the outcome. Like all these things we want to be able to deliver to our clients or our patients so that they can achieve their goals. So, you know, it's one thing just to complain about it and shame people, but at the same side, we're providing tools. We're providing access to folks to get healthy.
Mm. Kwadwo, I've heard you talk on another podcast just about how you and of course your wife as a psychologist as well, like it's in her area, what you notice in terms of the impact of the strategies taken with regards to, say, school lockdowns and gym closures and things like that. Like, have you noticed a shift or a change in like children and kids as a result of those tactics? Because here in New Zealand, so we had here in Auckland particularly, the latter half of 2021, we were still holding strong to those lockdowns. Like we had 108 days lockdown in Auckland, kids not at school for all of that time. And now what it appears like, it's like schools are very quick to close for things that I couldn't have imagined they'd close for. Like it rained the other day, we had school closures, and I'm like, it's just too... I don't know, there's just this, it feels to me like there's a real sense of panic and fear, not just around this, because this is sort of largely gone now, but in other things as well. Have you noticed something similar, or what's it like for you?
100%. There's so much to say here. So for more of the serious concerns, we know that childhood obesity, type 2 diabetes were on the rise. We know that eating disorders were on the rise. And the fact that all these mental health services for children have been overwhelmed means that a lot of people aren't getting access. So this problem is not minor. And and I can look at my own kids, like I've seen them bounce back personally. Like I think they bounce back from the impacts of that they had in terms of their mood and their energy. But that took some time, and we have resources, right? Like we have parents in their parents are in healthcare and are like on it, right? And the impacts to me have been, I'll just say it's unforgivable. Even little things when we had this approach of this, the let's stop COVID at all costs, well, the risk to the kids. Think about even the RSV surge. None of these kids had exposure to a cold. Like no kids were getting sick, and that lack of exposure. You'll see some people with differing opinions, and just from my humble opinion, as not an immunologist, but as someone that went through medical school, is your lack of exposure to pathogens is not healthy. Whether it's ramping up your immune system, maturing your immune system, people will have different opinions about that. But the lack of exposure to pathogens, to me, is not healthy. The fact that you would have 2-year-olds that have never played with another child before, who knows how that's going to impact their development. We'll find out. The impact on the kids. This is where I'd like to think of myself as a bit of a forgiving person, but this to me, when we knew their risk was so low, was unjustifiable how we treated our children.
Yeah, yeah. So interesting. And I feel like that despite there being again information out there on the risk associated with children, it was I don't know if ignored is the right word, but it certainly wasn't acknowledged, like particularly here anyway, it was very much a that sort of culture of, we must protect everyone. But then also when the vaccine was available, there was that, I don't know, again, what it was like in Canada, but in New Zealand, if you didn't get vaccinated, then basically there were 2 tiers of society. So that was one thing. And regardless of how you feel about vaccination or not, because vaccinations, they've saved people for, like hundreds of years. I don't know what the history of vaccines are like, but yes, they save lives for sure. Mm-hmm. But then when it became clear that it didn't stop transmission, and yet the messaging on the media was still protect your whānau, protect your family, get vaccinated, but nothing about go for a walk together and get some exercise.
Yeah, this is where I found it troubling as well, and I want people to understand this perspective. At some points during the pandemic, I'm having our staff, all of us, sleeping in the hospital, doing hours that were insane to be able to provide care for our patients. That being said, the fact that we didn't give people the rights when it came to a choice about the vaccine, to me is wild, like wild, especially as we learn more and more about the transmission side. But I come from a country really where you give people choice. And when you had a situation where, like in my country, this is where I feel like we lost our way and lost our values. If someone chose not to get vaccinated and they had a loved one across the country, there was they weren't allowed to travel to go see their loved one. And the thing that people would say, oh, they're so selfish and what have you, but listen to their story. Some people, it's not as black and white as you think. There's going to be the people that you hear about on Twitter, on the news, that are like, don't ingest me. I'm anti-vax or whatever, anti-vax. I'm not going to take any vaccine or whatever. But then there's the people that had an immune disease. I knew a guy that had a neurologic disorder that they were worried would ramp up if he took the vaccine. I know somebody that had anaphylaxis, needed to close to being on a ventilator because of the vaccine, and was forced to take a second dose. You know what I mean? Like, I know, being in, I don't know how common knowledge this is in New Zealand, but the like Black communities, Indigenous communities are often, they don't have trust in the system because of historical mistreatment. And so when somebody comes in and tells them that you got to take this, they're naturally hesitant because of the way they've been treated in the past. Now you're going to punish them for wanting to take time and think about their decision? No, man. What country is this? Like, where are our values? And the thing that we knew about the vaccine at the time is, if I take the vaccine, regardless of your views on transmission, if I take the vaccine, I will protect myself. So that is what matters.
Yeah, yeah. So it should be your choice.
I don't care what the person beside me has done, because I know I've protected myself. Do you know what I'm saying? So, like, why are we losing our minds over this? It didn't, like, it was beyond reality. I kept on thinking I'm in the twilight zone. I'm like, how are we treating people like this? When have we ever treated people like this? It's 2020 at the time, 2022. Stop. Oh my God.
Very similar. And thought, I wondered what it was like in Canada as well. But again, there are so many similarities between New Zealand and Canada. Like you couldn't necessarily share the views publicly, like particularly at the time, and even now, actually. Like I'm like when I see things and in the media around something, I'm not as, I went through a spate of being a little bit quick probably to share my opinions, and I definitely and afterwards I questioned whether or not that was necessarily whether I should have done that, and now I'm just a little bit I don't want to focus and dwell on it, I suppose. But I like having this conversation now about sort of reflecting back on just how strange the whole thing was.
Oh, and I don't get me wrong, I do the exact same thing. I can't count how many times I got slack for retweeting something or commenting on something. I had attacks on our family online. I've experienced it all, and it was all often would stem from Twitter. If I'm being honest, it's almost always with Twitter, which I always said was so medieval how people would treat each other on that platform. But I kept on saying, like, for the most part, most of the people that would have the loudest voices when it came to Twitter, the Twitter mob or COVIDians, had never treated a COVID patient, or at the time never seen a COVID patient. So, with all due respect, walking a day in my shoes, or coming to our ICU and tell me that my perspective isn't valid, and and to be honest with you, I don't mind differing opinions. I've been with other intensivists, or infectious disease docs, and had civil disagreement, and I've been wrong about certain things. Like I in April 2021, with the vaccines out, I did not think our third wave was going to be massive. And it was really massive.
Yeah.
And I thought because of us vaccinating the most vulnerable that we would be okay. But the metabolic disease component was, I didn't factor in, and publicly said, I got this wrong. I'm okay to to call it out, because that's what leaders do. You own it. And but there were many times where we were on the right side, and I think overall, when history has shown that many of us that were advocating for balance were justified.
Yeah, for sure. And out of all of this, I think it's what I saw from how you talked at Low Carb Denver, and what I've seen of your work. Actually, what you want to do is have a message of resilience, right? Like, we are not as fragile as what we've been not led to believe, but like that whole fear messaging. I feel like people then start feeling more vulnerable than what they need to, but actually you can be resilient and you are anti-fragile, and that's a lot of what your messaging is out there for now, right? It's to give people tools so they can look after themselves and know that if there is in the future any and everyone talks about, oh, and this is, the first of, this is just how it's going to be from now on, whatever. But at least now that you're now in this position to share that information of good metabolic health, of being active, of exploring diets that might work for you that are different from those mainstream sort of recommendations and things like that.
Oh yeah, I couldn't phrase it any better, Mikki. This idea of being anti-fragile. I mean, think about how important it is to feel empowered, to feel that
Yes.
you could have a voice in your destiny. Like that's vital. It's fuel. It's what many people need to hear, and it's true. I give this story once in a while where I was treating a guy who was in his 70s and had an accident, fell off, tripped and fell, hit his head, and died for 2 to 5 minutes, somewhere in there. And when you're in your 70s and you have any cardiac arrest, when you die, you usually don't leave hospital. So what made this man different was the fact that he went to the gym 5 days a week. He was fit for his age. Because of that, he was one of the first patients to get up when, like, in terms of how, like, physically get up. He was walking on a ventilator. He was highly motivated and had that reserve, that body armor to withstand all the complications that happened during his care. And he went home, and he is functional, and he now is in his 80s and still been able to travel, play with his grandkids. Like, all of that is a possibility because he took care of himself. Because that is not the norm. The norm is, even if you survive that cardiac arrest or if you die, you either don't leave hospital or you end up in a nursing home at that age. That's the norm. And so even from, yes, on the preventative side, less likely to land in hospital or in ICU. But if the worst thing happens to you, you're in that much better shape to recover. Same thing with one of my colleagues' wives, Cindy Hooper. Pancreatic cancer back in 2012. Triathlete, the will of ultra champion, did an Ironman on chemo.
Oh my gosh!
And she's 10 years out of her cancer. Like,
oh my God, pancreatic cancer too.
Yeah, like the story's evolved. She got unfortunately got a recurrence and is on palliative treatment now. But
yeah,
like the longest pancreatic cancer, one of the longest pancreatic cancer survivors that I've ever heard of, and because of how her willingness to be fit, but also what that also does too is the underappreciated aspect of this is the mindset. Like, you've gone through the ringer whether you're doing your marathons or you've been to the gym. You go to the gym even though you don't feel like it. You exercise that resilience muscle. You exercise that I could do this even if I don't feel like doing it muscle.
Yeah. Yeah.
And it leads to survival. It leads to being functional. And that's the power of healthy living. That's the power of getting up, working out. That's the power of thinking about what you eat. I see it on a regular basis, and that's it's effective. It works, and that's why we want to encourage people to do it themselves.
Totally. And then if I think about children, like, this is what we want for our kids as well, obviously, but, because I think of people who are in the position of that 75-year-old, and that is quite rare, but that is something to aspire to be when you're our age. I don't know how old you are, Kwadwo, like I'm 45, and I'm like, hopefully when I'm 75. Are you? Oh, there you go. Yeah. But then also, what about the 25-year-olds who aren't even thinking like this? Like, and, the 18-year-olds, like, actually, it's never too late, but it's also, it's never too early. And I just feel like some of this cotton walling that's gone on with teenagers these days could have changed the trajectory of how they how they view the importance of this stuff. I don't know. Like in some circles, of course, we run in circles where it's the norm. There, of course, children need to be active. Of course, they need to eat healthy. Of course, they need to do all these things, and we need to be in the gym and lifting weights and whatnot. But it's a small bubble compared to like, I don't know what the stats are like in Canada actually for metabolic health. I always hear the US stats and they are horrific. I wonder what Canada is like, but so many people just still like this message isn't penetrating, I don't think.
Yeah, I worry for the demographic that went through high school years and so forth, not having to move as much. They're on their phones. They were stuck doing homeschooling as a result of the pandemic. Those are formative years, not only socially but also physically. Your time to play your high school sports. Like some of my fondest memories are playing city finals in basketball, volleyball, track, whatever it might be. And I'll be honest with you, this is one of the areas where my wife and I took very seriously, like the healthy living. We want to be the example for our kids. Like we don't have to always preach it. They see it. Dad's in the gym again downstairs, right? Where mommy's doing another yoga session. Where we're talking about, we celebrate having a significant amount of protein on their plate.
That's awesome.
We do this tradition in our house. We call it going beast mode. So if you finish and don't get me wrong too, but by the way, like my kids will eat junk, but we still want to emphasize that, if you eat better, you feel better, and you're more likely to thrive. And so one of the things we do is whenever, especially the younger two, if they finish off their meals, you get to take off your shirt, stand on the chair and say, beast mode, and flex your muscles, right? And so that's the tradition. And I'll go beast. You gonna go beast mode today? Got to finish off that chicken breast before you go beast mode, son. And then the shirts come off. And I mean, Daddy always finishes his meal, so he doesn't have to go beast mode. But every once in a while, I won't shy away from it either. But yeah, it's so you make it fun. You make it part of culture in the house. But we make a real point of being the example, and I don't know. We'll find out years from now if it's effective. But always be the change. Like better to show it than to preach it.
100% agree with that. So, Kwadwo, as I understand, your sort of platform that you sort of educate on this stuff isn't just for the general public. You're doing it for your colleagues as well, like people who are interested. Am I right in thinking that?
Yeah, in a way, we frame it in a wellness space where during the pandemic we did see a lot of burnout, and we on our own platform and through a grant we produced a project called Solving Wellness, which provided online tools for people to improve their wellness, and the pillars were nutrition, movement, community, and oh my goodness, why am I forgetting?
Sleep.
Yeah, stress management. Thank you. Yeah, stress. Yeah. Which is for healthcare providers is almost always sleep is one of the key pillars. So yeah, we often get to give talks to other healthcare organizations to talk about the ways to address these things, and just naturally through my job and the platforms we created, a lot of healthcare providers reach out or connect with me, which is really exciting from my perspective because they're amplifiers, right? Like if you have a nurse practitioner, family doc, can bring some of these concepts to their practice. People often go to them for advice because you're in the healthcare field. So anytime that you can reach out and connect with someone that's in the field, the healthcare field, to me, that's a massive win. And so, yeah, that's been an area that we've been tackling for sure.
Yeah. And what about personally for you, Kwadwo? So obviously you've always, you and your wife have always valued health and wellness through your own practices in your family, but did your own habits change after coming across low carb fasting and all that. I'm really interested to see, like, what have you sort of tried and explored? Because everyone wants to know what are those people? What are they actually up to?
Yeah, I love that question. So I started doing intermittent fasting maybe 5 years ago. I jumped on the train with I think it was Peter T. I think I heard him on Rogan and talk about the benefits of fasting. So I tried it out mostly for convenience and the ability to essentially like eat whatever I want. The quantity of that, maybe not
Yes.
the type of food, but the quantity I want during my eating window. And I thought it was so convenient. And then I liked the way I felt when I was working out in a fasted state. And so I really harnessed that. Sorry, the baby just entered the building and
That's so good.
he's loud. I'm sorry, but the since learning about a lot of this, I've tried. So I tried. My carb ingestion is down for sure. I try to approach it as during a work week. If my first meal is I'll have carbs, but it'll be less than I would have at night. I find it can help you wind down a little bit if you're just more of the carb uh, nocturnally, and sometimes it. I don't know if this is true, but sometimes at least psychologically, I feel like it helps with improve my sleep. But
No, that is true because it's the serotonin thing, right? Carbs
yeah,
help produce serotonin, help produce melatonin. Yeah.
yeah. So ever since doing that, I've noticed that 2-3 p.m. I'm less likely to need a coffee because I'm just more less sluggish. So I've tried that. I tried keto for a 2 week period, and I didn't like myself on keto. I lost like
Yeah.
5 pounds, and I didn't need to lose 5 pounds. I
No.
was crampy, and I tried the electrolytes. Like it just wasn't for me. But obviously, I still advocate it for people depending on what their circumstances are. And yeah, those are the main things I've tried. I mean, you learn more stuff, little hacks too. Like I had a CGM on for, what was it, about 2 or 3 years ago. I found that fascinating. I suggest it for I mean, I'm sure you mentioned this before, but I think everyone should try a CGM for a period of time, continuous glucose monitor, because the things you learn were fascinating. Like if I was on call, if I had the 2 or 3 hours of sleep, my glucoses were all over the place. If I was
100%.
if I was doing a big leg day, I could eat
Yeah.
anything and there was nothing, and my glucose was nice and steady. Um, the idea of like if I had a carby meal and you add a bunch of protein to it, level things off. Walking post meal, that also I noticed would stabilize your blood sugar. Like there was so many little things that you learn that you
I
could
know.
bring.
So I learned like there are these protein bars which I used to love, and I still love them. They're low carb, apparently low carb. They're these vegan. I'm not vegan, but these are vegan. And the fiber in them totally spiked my blood sugar. So even
Really?
though they say it's like 1 gram of sugar and 3 grams of net carbs, the type of fiber they use spiked my blood sugar. When I have wine and hot chips, I love a hot chip, like a nice pub chip. Like
Oh,
my
like French fries? Like
yeah, like
yeah,
French fries,
okay.
but fat ones,
Yeah.
not these skinny ones. Stable, really stable blood sugar because the alcohol brings your blood sugar down. I'm not advocating this as a healthy thing to do, but I just found it. I agree with you. I thought it was really fascinating, and people can learn so much about how food impacts them because it's so individual. Like we can come out with these like guidelines and these recommendations, but until someone sort of tries it on for themselves, they're never going to know.
Exactly. And it just, to me, it's not to get too philosophical, but and it's where I hope my research platform goes is more personalized health, like really
Yeah.
thinking about who's in front of you and what's optimal for them, despite what the studies on a general population might tell you. Because we approach our research studies with often with the general public in mind. You give this patient group X versus Y when they come into a hospital for their heart attack, and this works 3 increases your absolute risk of reduction by 2-3%. But we never ask ourselves who's going to get the most benefit from it. Like, we never approach research that way, which I think is where we need to go, because really that's what matters. It's you and I might take the same drug because a study said it'd be more effective, but because of my genetic background, because of my gender, I might be less likely to respond to it. And we need to be asking those questions more often. But yeah, when it comes to nutrition, anybody that comes telling you is the cookie cutter, like everybody needs to do X, Y, or Z, that's when you got to walk out the door.
Yeah, 100%. Kwadwo, I really loved our conversation. Like, I really wanted to just really get a feel for your work and also what you saw and also your approach now. Like, I think that's it's great, and you're so available with regards to the information you put out with the podcast and the Substack. So can you just let us know where people can find that information?
Oh, thank you once again, Mikki, for just being a monster advocate for health and wellness and everything beautiful. The easiest place to find us is the Substack, so Kwadcast, KWADCAST.substack.com. And we house everything there. We have our ebooks, our podcast, video posts, meal plans. I'm hoping to have our book out. It's a book on leadership out that hopefully that'll be out soon, and we'll obviously have that information there. And then anywhere on social media is at Kwadcast. The biggest ones on TikTok or IG. So because we're welcome to hear people's input, and we aim to deliver to, once again, with that goal of just getting folks healthy.
Yeah, awesome. And Kwadwo, are you speaking at any conferences coming up in the near future?
I'm trying to figure out if we're going to Omaha or not. Is it Omaha? It's Be Fit and Fabulous.
Yes, it will be. It is, isn't it? Nebraska?
In Nebraska, yes. Right now I'm supposed to be working, so I'm seeing if I could finagle that one. And then otherwise, I don't think that there's a couple non-conference talk, like speaking engagements I'm doing, but I love those conferences, by the way, like the low carb, the energy, the lack of dry content. It's so different than a typical medical conference. So I look forward to. I think the next one I'll probably go to is the Metabolic Health Summit in Florida. I think that'll be.
Yeah, I'm booked to go there as well, just because they are the best conferences. Like that and the Low Carb Denver, like that was it. You learn so much, and even like when you know stuff, like often you think I'll go to a conference, won't really learn that much. You just are blown away by the content and the stuff is awesome. Yeah. Awesome, Kwadwo. Well, thank you so much. I will put links to your Substack and your Instagram account in the show notes. And I really appreciate your time. Thanks for taking the time to speak.
Thanks so much for having me.
All right, team, hopefully you enjoyed that conversation, and I'm sure you got a sense for just how passionate Dr. Kwadwo is in this area. So I'd certainly recommend checking out his website that is in the link, and of course his podcast. He had done an interview just in the end of May with Lara Bryden, who you know is a good friend of mine, and that was a fantastic talk as well. So you will get a lot from the information that Dr. Kwadwo shares. All right, team, next week on the podcast, I speak to Dr. Ted Naiman all about my favourite topic, protein and protein to energy ratio and satiety. Until then, though, you can catch me over on Facebook at Mikki Williden Nutrition, over on Instagram and Twitter at Mikki Williden, or head to my website, MikkiWilliden.com, where you can book a call with me or sign up to one of my meal plans. All right, team, you have a great week.